Welcome back to Tuesdays with Timeless. I'm Dr. Stefanie Christian. In the month of November, we've been talking about filler injections. We've covered cheeks and the area around the mouth. And today we're going to talk about the less commonly known areas that can be filled. Although they're less commonly known, they are areas that can have a significant impact on appearance. We're going to talk about the tear troughs. We're going to talk about the jawline, and we're going to talk about the earlobes. Tear troughs are the deep creases that appear between the lower eyelid and the cheeks. We tend to lose about a tablespoon of fat in the face a year. It's genetically predetermined where we're going to lose that fat. And for some people, that happens right here in the tear trough. And then as we age, they lose more and more and more there. So eventually the skin is right on the bone. And that means that this little puff of skin above casts a shadow there. And those people will often come in and say, I have really dark circles. But they don't actually have dark circles like some other people do, where they're having a little bit of hemoglobin leak out of vessels and discolor that skin. They have dark circles because they have shadows. So, what's the treatment? Injecting into those tear troughs. The goal is to inject a mildly volumizing filler. And we choose hyaluronic acid, which is a gel-like substance that occurs naturally in the body, but is created synthetically for injection. And we want to fill in those tear troughs to get rid of the indentation and therefore get rid of those shadows. I sort of call it sleep in a syringe. It is a filler. It will last usually less than a year. And the best candidates are people who have mild to moderate indentations, who have nice skin, it's not completely crepey, and who don't have herniated fat pads. Some people have fat that herniates under their eyeballs, and they have large bags under their eyes. These are not like people who get bags when they have allergies. These are people who have bags all the time. No matter what they eat, no matter whether they're sleep deprived, they're always there. And you can actually sort of see the herniated fat there. And the only correction for that is surgery. We can try to minimize the crease under those fat pads a little bit with some filler. But the correction for herniated fat pads is a surgical one. So, next is the jawline. As we age, the jawline gets a little less defined. A couple weeks ago, I talked about how the cheeks are the foundation of the mid-face. Well, in the same way, the jawline is the foundation of the lower face. And as we age, we have a significant decrease in the volume of bone in the jawline. And this results in some sagging of the skin and a decrease in the chin protrusion and a loss of jawline definition. So you can have a facelift and that will pull the skin tight, but that won't increase the volume. And so you won't get more volume in your chin, and it won't give you back this angle here, which is really important in terms of giving you balance in the face. So you may end up needing both. Even if you decide to go in for a facelift, you may still need filler. So part of the treatment, at least, will be injection in the jawline. And we have a couple different fillers that we can choose from. And I go into in depth these various fillers in the video I made about cheeks. but I will briefly mention that the two most likely options are either just a filler that has a lot of cross-links and a lot of viscosity, like Voluma, or a filler that has a lot of viscosity, but also is a biostimulator and therefore builds collagen, like Radiesse. We tend to like that in places that are deep, where we're going right on the bone, like we do right back here when we're helping to build back up that angle, and like we do here right in the pre-jowl sulcus. And so what we're doing here is we're building up the angle of the jaw, and we build up the angle of the jaw differently in men than we do in women. What we're trying to do is simply create that angle again if we've lost it, but it's a much more defined, heavy angle in men than it is in women. And what we want here, we want to have a nice, smooth jawline. The best candidates are people who have mild to moderate jowling and a loss of that angle. If we have a little heavier jowling, then we have a really great alternative, and it's called PDO lifting threads. PDO lifting threads are absorbable sutures that we've been using for about 30 years in surgery. And they have little tiny cogs on them that make them sticky. And they're preloaded into needles. And we find the vector that will give the best lift. And sometimes we have to go high, and sometimes we have to go laterally. And we make a tiny entry hole with a needle that's just a little bit bigger than the needle that has the absorbable suture in it. And then we enter there, and we go down to that point where we want the lift to be. And the thread sticks there. And then as we take the needle back, we pull the skin up over the thread that is being revealed. And we get a nice little lift, and then we cut off that tail of thread. And that's PDO threads. And sometimes we actually have to do PDO threads and filler. The PDO threads give the lift, and the filler gives the volume. Some people get a receding chin line. Some people have a receding chin line genetically, and some people notice that they have a receding chin line once they have a nice smooth jawline, or once they've had a replacement of the volume in their lips. If you take something that's firm and you put it on the tip of your nose and down to your chin, like this, so it's actually touching the tip of your nose and it's actually touching the tip of your chin, the lower lip should be 2 millimeters behind it, and the upper lip should be 4 millimeters behind it. If, when it's on the tip of your nose and you're taking it back, the chin doesn't touch it, it's bumping into your lips and it's not even touching your chin, then you know that your chin is too far set back. There are all sorts of fractions and magic numbers that people use to determine what the perfect, beautiful face is. Well, that's wonderful if you have a face that's set up with those kinds of numbers, but most of us aren't born with faces like that. And if you have, if money is no object, then you can go to a plastic surgeon, you can have things done to give you those perfect numbers. My goal is to have you in balance. So a lot of times people will come in and one side of their upper lip is larger than the other side of their upper lip. Or one eyebrow is higher naturally than the other eyebrow. And we can do things that will bring things into symmetry. Or someone has a partial Bell's palsy, and so one side of their face has a little bit of a paralysis, and that will pull down part of their mouth. And so we can do things with filler to try to correct that and make it more balanced. So to me, it has a lot to do with having you look like you and the best you that you can be, and not actually measuring out and having percentages. But there is a certain amount of balance that is considered attractive and appealing. And if the chin is set too far back, then often our nose and our mouth looks too big. So we can inject in the chin. If what you need is 7 or 8 cc's, then really we shouldn't do that with injection. That needs an implant, and that needs a surgeon, a plastic surgeon, to put in an implant. But if what you really need is only 1 or 2 cc's, that can be done pretty easily with an injection. And we can do that. It's pretty easy. We can just do the injection. We do it under the mentalis muscle, which is down here. But if we're trying to put in 6 to 8 cc's, there's a real possibility that we're going to compress vessels here. And we don't want to do that because, you know, the Hippocratic Oath, first, do no harm. And last but not least, this is one of those really fun ones. As we age, we lose volume in the earlobes, and the earlobes just get thinner and thinner. So sometimes when the earlobes get that thin, post earrings will hang angled downwards. They'll sort of curve under. And heavy earrings will start to pull and elongate the earring hole. And this is another really easy and fun thing to fix. Let me take these earrings out so I can show you. We'll take a hyaluronic acid filler again, and we'll inject some tiny little aliquots around the edge of the ear, and that will build it back up. And then we do take some inside the ear to build that up as well. If the hole itself has gotten lengthened, then I will inject around that until it compresses the hole from being a long vertical hole to being more of a circle. Now, once again, this is a temporary fix because these are hyaluronic acid fillers, and hyaluronic acid fillers are metabolized by the body and absorbed. And so you're going to have this redone. Interestingly, you don't have to have it redone as often as you have to have other fillers redone, because you're not moving a muscle in your earlobe. And so, you know, sometimes you don't have to have that redone for a couple of years. So, once again, if you have questions about any of these, just comment below. And I hope you have a wonderful Thanksgiving. I wish you all the blessings in the world, and I'm very thankful for each and every one of you. I will see you again in a week.